Today we're going to talk about Lyme disease. We're going to talk about what you need to know about Lyme disease, because the more you know about it, the better your outcome will be if you do contract Lyme disease. So joining me today is my father, Dr. Phil Pappas, who has a 20-year background in pharmacology, a PhD in nutrition, and a master's in psychology. Thank you for joining us today, Dad.
Nice to be here.
All right, so let's get to it. What is Lyme disease?
All right, so Lyme disease comes from a tick bite, usually vector-borne. We call them vector-borne diseases. You can get other insects may be able to transfer Lyme disease, but for the most part, we're looking at the small deer tick as being the main cause of Lyme disease. And Lyme disease is a bacteria, Borrelia. And Borrelia is a bacteria, it's a spirochete bacteria, meaning that it has a hard shell around it. Other bacteria maybe have a lipid type of membrane around them, and antibiotics attack that membrane and break it down, but a spirochete is hard. So certain antibiotics can break that shell, but not all antibiotics. So when you're being treated, the doctor has to pick these very specific antibiotics for you. And there are other bacteria co-infections that you can get, like ehrlichiosis, babesiosis, Rocky Mountain spotted fever. All these should be treated and all have ramifications. Now, just to talk a little bit about the incidence of Lyme disease. Back in 1991, maybe 4 people out of 100,000 had Lyme disease. Today, we're looking at 8 or 9 people out of 100,000, and we're not really looking at the unreported or undiagnosed or misdiagnosed Lyme disease patients. So one of the estimates is from the CDC and other estimates out there. We're looking at close to 300,000 people a year getting a tick bite that results in Lyme disease.
Wow, that's a lot
That's
of people.
a lot.
How does someone get Lyme disease?
Well, again, they're going to encounter a tick, probably a deer tick. And a deer tick is tiny, so you don't know it's on you. You don't know where you picked it up from. But if you're walking in grass, if you're walking in weeds, if you're walking through the woods, on a wooded trail, it could be anything. It could be your animals going out in your yard, going
Cats,
under bushes
dogs,
or whatever, coming back in with a tick on them. That tick walks around, eventually bites you. By the way, animals have Lyme disease, and your veterinarian will identify that with a simple in-office test. It's real quick. This test probably would be nice if it was available for humans, but for some reason it's not. So you have to go through the testing. But just so you know, it's very easy to get a tick bite in this country and in most parts of the world. If you're in the middle of a desert where there's no grass, there's probably not going to be a lot of ticks.
Right.
But if you're in this Pennsylvania woods, Massachusetts woods, where you have a lot of trees, the East Coast in particular, full of greenery and trees, that's where you're going to see this.
There are 3 stages of Lyme disease. Dad, tell us about the 3 stages of Lyme disease.
Okay, so the original stage is where you get the bite. In maybe a week, you'll get a rash, and you maybe see some symptoms. So now we're already to the 2nd stage. And then the 3rd stage, you're feeling bad, you go to the doctor, and he's going to treat you. And you may actually start to feel a little worse when you start to get treated until you kill enough of the Lyme disease out that you don't feel that toxic result from the kill-off of the Lyme disease. We call that Herxheimer's reaction. You start to progress and feel a little better. So that's basically the 3 stages.
How do you feel when you have Lyme disease?
Okay, so this can vary a lot. You might not know you have Lyme disease, but for the most part, you're going to get, and I think most people do get this, you're going to start feeling achy, stiff, you may get fever, chills. This may all seem flu-like to you. And you may not recognize what you have, but if you spot the rash, You should put two and two together, and you know something's happened. You need to get to the doctor. You know, if you get a cold or the flu, you shouldn't have swollen, painful joints, and that's what Lyme disease will do to you. I mean, really painful joints. There's also a possibility where you don't get a lot of symptoms and you get a Bell's palsy on one side of your face, possibly. And that's something you should be, you know, I have no symptoms of anything. Why do I have Bell's palsy? You need to find that out right away. That's a symptom of Lyme. So this can be very obvious, or it can be much more harder to diagnose.
Right. That's crazy that it can mimic other viruses or illnesses. What is the first sign of Lyme disease?
Assuming you get the bullseye or the rash, that would be the first one. If you don't, you still may get fevers. You know, might get fever 3-4 days in a row at a certain time of the day, let's say in the evening. Something's up. You might get a headache, like the chills, fatigue, muscle pain, swollen lymph nodes are telling you something, you know. Should be putting this information together and getting to the doctor when you see these things. Although all these symptoms could be common to the flu, you need to look at them carefully and make sure that it's, you know, that it is the flu and not actually a tick bite.
Is there a cure for Lyme disease?
Well, yes, there is. And the antibiotics we have today are perfectly adequate to take care of Lyme disease. But because it is a spirochete, you might need more of that antibiotic than you would for some other condition. We have the tetracycline family, doxycycline. It's a more advanced tetracycline. Works very, very well on the Lyme spirochete. So doctors have learned to use doxycycline as first-line treatment for Lyme disease. There's other antibiotics that can also do the job, but doxycycline is kind of ideal. Has less side effects for most people, and it does a good job in the allotted amount of time. Now, the right amount of antibiotic is important, and so is the time you take the antibiotic. So a doctor has to figure that out for you. But it does take a lot more antibiotic than it would be for just, say, a strep throat.
I'm sure people are wondering if there is some sort of a blood test for Lyme disease.
There's always, for long as I can remember, we've always had a titer type test for it. But unfortunately, that's only 50% effective. That's usually the first test we've been given over the years. A doctor should look at that carefully because it's 50% of the time could be wrong. And if symptoms say this person has Lyme disease, then they should go for other tests, which a lot of the labs in the country have. One of them is the Western blot. A lot of people know that by name. There are other tests that measure other parts of this. Your doctor should be able to figure out which tests you need. And it's important because one of the co-infections would be Rocky Mountain spotted fever. You need to know you have Rocky Mountain spotted fever because it can do a lot of heart damage. So it's important to get treated for that.
And do you have to go to a specialist, or can you just go to your general practitioner to get tested?
Well, not all general practitioners have experience with Lyme disease. So they refer out to other practitioners who handle Lyme disease more often. But there are GPs who know how to do this. So you could have a rheumatologist helping you. You could have a Lyme specialist or an infectious disease specialist helping you, working on this. But a GP who has good experience should know what to do.
So I'm curious, does Lyme disease stay with you forever? Are you stuck with it? Can you get rid of it?
Well, if you actually have Lyme disease and you get over it, you're going to have some antibodies that tell you you had it. And those antibodies are good because that's part of your immune system. However, not everybody gets over Lyme disease completely. It is a spirochete. And about 20% of people either waited too long or this is their third or fourth bite and they didn't know it.
Wow.
It could be a combination of things. Something was too much for that person. Their immune system couldn't handle it. They could have spirochetes in their system for extended periods of time. But for the most part, you're going to be treated and you're going to get well.
Mm-hmm. So you could have it in your system, but you may not have symptoms. So you could be asymptomatic.
Possibly, but very often that 20% is suffering from things,
Yeah.
chronic fatigue, headache, that type of thing.
Yeah, other ailments that you might just brush off.
Yes. Yeah. And that's why we're here today, because we have follow-up for that. And the follow-up's important.
Is it possible for your body to fight Lyme disease on its own?
Yes, if you've got a good immune system, it is possible, but it's risky.
Mm-hmm.
If you know you have Lyme disease, you want to be treated.
Yeah.
And then you might want to follow up with your own additional treatment, which we're going to talk about in a minute. But yes, you could, and some people, many people get treated and walk away and they're fine, assuming they don't get another bite too soon.
How serious is Lyme disease, and is there long-term and irreversible damage?
Yes. 80% of the people are going to, 80% of people are going to fare well. They're going to get over their Lyme disease. 25% will have some kind of lasting problem, either damage, because they didn't get treated quick enough or were misdiagnosed, or just kind of like, I can't get rid of those spirochetes. So it's a combination of things. So what are we really talking about? Well, if you have that joint damage, you could have, actual damage where you need to have a joint replacement. So your joints are aching, and that could be a result of long-term Lyme disease.
Mm-hmm.
You might get, and it gets more complicated, you might get cognitive difficulties. How do you fix that? So that's a real tough one. You end up with memory problems, all kinds of cognition problems. It's a possibility, and it does happen in that 20% that don't fare well. You might have chronic fatigue a lot. You might have sleep disturbance. You might have heart problems. That would be really terrible, but heart problems happen as a result of Lyme disease. So yeah, it's important that you get treated and that you get treated properly.
Mm-hmm.
Now you could end up with a condition known as post-treatment Lyme disease syndrome. That's a small percentage of people, but it's a terrible situation. Those people are really having difficulties.
Mm-hmm.
Very often they're disabled.
Oh, that's awful. Let's talk about natural treatments for Lyme disease. I think that this is really important because, you should take the antibiotic, and then you need to prevent the Lyme disease from coming back, because it does come back, right? If it can come back, it's not like the antibiotic is a surefire.
It's not a guarantee.
Yeah.
So when you think about what can you do, well, we have a lot of supplements that actually can help because they have antimicrobial bacteria action. So one thing that it's a cornerstone, I think, for me when I work with a post-Lyme patient, and that is berberine. Berberine's an herb. It's very famous for diabetes. Berberine is protective to the heart, so it's helpful when you talk about Lyme disease. The heart is something you got to worry about. It's anti-inflammatory, the joints, so you got to worry about it. So it's a great product. It's like a cornerstone to the treatment. The other thing I like to add, maybe for 3 to 6 months after treatment, is oregano oil. Oregano has a broad antimicrobial pattern. It can kill fungus, it can kill viruses, it can kill bacteria. And in particular, we're worried about the Lyme bacteria. So oregano is a good add-on with the berberine. So both these two are very antimicrobial and are doing the right job for you. They're anti-inflammatory. Garlic. Now, one reason I like to add garlic is it's very protective to the heart. And it is antimicrobial in its own right. So garlic's a nice addition. The other thing that is very helpful, and you have to understand, Lyme patients get a lot of muscle pain and spasm. Magnesium, which we're all deficient in, pretty much 90% of the population, magnesium really helps that a lot. But we have to understand magnesium also is protective to the heart.
Mm-hmm.
So this fits right in with the other supplements that I've mentioned. Now, we like to use magnesium L-threonate. I'll say it again. Magnesium L-threonate. It's a patented form of magnesium. Has the ability to cross the blood-brain barrier. That's really important in Lyme disease because you want to, you know, is the person's memory going to be intact? Are they going to have cognition issues?
Mm-hmm.
Magnesium does that for you. It's a real good product that way, and this one crosses the blood-brain barrier. Also, magnesium in the long run is just going to calm you and relax you, particularly L-threonate magnesium, because it does cross the blood-brain barrier. So you're taking care of, you know, Lyme patients very often develop anxiety, depression, about 50% do. So what are you doing for that person? For their cognition, for their calming, for their stress, for their anxiety. L-threonate, magnesium L-threonate will do that. Another thing I like to add is fish oil. Fish oil is anti-inflammatory, good for the heart, and it's a perfect, you know, good for soft tissue and joints. It's a perfect add-on, and fish oil is healthy for you anyway.
Mm-hmm.
So it is kind of an important thing to have fish oil. Now, one very important thing that we didn't talk about, and we can talk about it here, is when you're being treated for Lyme, you're taking an antibiotic, you should be taking a probiotic along with it. And I'm going to be very specific here. You take a probiotic 2 hours away from an antibiotic. So you work your schedule of antibiotic and probiotic,
Yeah.
and you leave that space. Antibiotic kills probiotic.
Mm-hmm.
So you take your probiotic and put it back in after the antibiotic does its work.
Mm-hmm.
So that's important. You need to follow up long-term with probiotic because when you get treated with heavy-duty antibiotics over a long period of time, you've got to rebuild the gut. You've got to build the microbiome back. And that's what builds your immune system. And that's what makes everything start to work better. You even blood sugars will work better if you've got a good gut. So it's very, very important. Also, what happens, I'm being treated for Lyme with antibiotic and develop diarrhea. That's very common. Antibiotic induced diarrhea. So how do you handle that? You take a probiotic every time you have a loose stool.
Mm-hmm.
So if you have diarrhea, you know, 3 times in 10 minutes in an hour, you want to take a probiotic every time you have an incident, and that will probably stop maybe by the 3rd try.
Mm-hmm.
And then you're back on schedule. So you go from there. So we put all the products that I just discussed into a kit, and you'll see that on the website.
All these products are available on our website. It's www.earthfoods.us. There's a tab that says Lyme disease, and you can see that bundle that you
We call it a protocol kit.
a protocol
You'll
kit.
see some ticks and some tick bites. All those products I just mentioned are there in a kit at a good discount, by the way. However, maybe everybody doesn't need those, or they have them, some of them. So we have those individual products also. And then we know that Lyme patients sometimes and often develop sleep problems. So on the website, we have some sleep products that will help you. One in particular I like a lot is by BrainMD, that's Daniel Amen's company. And you've seen Daniel Amen on PBS. You know, he started out in ADD, ADHD, and now he's doing all kinds of cognitive studies and products. And this product is called Restful Sleep. And he designed it. It's a nice formula, and it works very well. That would be a product that you might try. So we have that there along with other sleep products. Sometimes with the anxiety and depression that a Lyme patient sometimes will develop, we have actually a couple of Dr. Amen's products for that. And you'll see them are pretty clearly described. Mood swing, stress, that type of thing. There'll be a few products like that. We also have a couple of products that are pretty famous by neuroscience. They do a couple of really good products that you'll see there. If you're not being successful with your antibiotic treatment and the other things we've mentioned, we also have on the website a silver hydrosol, form of colloidal silver. Now, silver is famous for killing bacteria, so that's an option. It's a liquid, and that's something you might take if you're just not having success, or you're in that 80% or in that 20% that wasn't successful or not completely successful in treatment. You might add something like that to help your immune system and help get over the bacteria. Also, in this country, we have a lot of zinc deficiency, so we do have a liquid zinc there also. Now, if you've not been healthy to begin with and you develop Lyme disease, it would be a very good idea to add some zinc to the formula.
Natural treatments are so important because whether you choose to go down the antibiotic route or not, you don't want it to come back. You want to reduce your chances of this coming back. So like when I had SIBO, for example, I did take an antibiotic, but after that, I followed it up with natural supplements. And you don't want to have to take an antibiotic again because it's so rough on your microgut biome. You don't want to do more damage than you already have. So I highly suggest the natural route. Even if you do take antibiotics, followed up with that. You can get all these supplements on our website at www.earthfoods.us. Go to the Lyme disease tab and it will have all these supplements right there for you.
And let me just say that everything that we have on the website that has to do with Lyme disease, you have to understand it's all good for you. There's no downside.
Right, it's not going to harm you.
Now, there's a good side to antibiotics. It's going to kill the spirochete, Lyme spirochete, but it's also going to mess up your gut biome.
Yeah.
And it could cause other problems. So it's important to make sure you do something for yourself after you've had your treatment with your doctor.
Yes, yeah. The antibiotics can do a lot of damage, especially to your microgut biome. So it's important that you do some self-care after that. And like you said, there is no downfall of using natural supplements. They're not going to harm you like an antibiotic would or have side effects. The side effects can go on and on from antibiotics. Thanks for joining us today, Dad.
I've enjoyed it.
Really enjoyed talking about Lyme disease, and I hope that it helps you guys, anybody who's struggling with it, or who knows if you get in the future or someone that you love gets in the future. You will be more educated now and able to help them. So thank you guys for joining us, and thanks, Dad, for being with us. Bye.